Welcome back, and we're moving into our first conversation this morning as we find out more about the Salud Mesoamerica project and what has been going on in Belize. We have with us on set to tell us more about it Dr. Arnelle Gillett, who is the project coordinator for Salud Mesoamerica, and we have Ignez Tristao, who is the social protection and senior specialist for the Inter-American Development Bank. Good morning and welcome.
Morning. Good morning. Thank you for having us.
Yes. So I want to start off by finding out a bit more about the collaboration between IDB and the Ministry of Health on this specific area and how it first came about, right? So, Ignez?
Yes, so Salud Mesoamerica is a regional initiative that the Inter-American Developing Bank, with 3 donors, the Bill and Melinda Gates Foundation, the Carlos Slim Foundation, and the government of Spain, have with all the countries in Mesoamerica, including Belize. And the main goal of this initiative is to accelerate progress towards closing the gaps in health indicators for maternal and child health.
Yeah. Now, the maternal and child health, and I want to break that down for a bit, is looking at the survival and health of both mothers and babies as they complete their pregnancy and they have the first couple of years of their lives for the children. My question is, why is this such an important development indicator for any country?
Well, so the survival of mother and children is very important for any society because it's really the base of any population, right? So this not only impacts the quality of life, but also the economic growth that the countries might have.
Yeah.
You know, just having the word Salud Mesoamerica, it brings much more comfort to the project. And we in this country, because a lot of villages, they're so remote, it's difficult to eventually get to mother and child or pregnant moms. So for Dr. Gillett, can you talk to us about how helpful this is and what it's really doing for mother and child, especially in the rural areas?
So in the rural areas, we have rural health centers. Unfortunately, we don't have a health center per village. So the nurse that works at these health centers, and we have rural health nurses that are there, what they do is that they do mobile clinics. Most of the time, they go into the clinic, they go in for mobile clinics once a month or every 6 weeks. It depends on how many villages you have under your responsibility. And so they're not able to always be there. So through the initiative, what we've been able to do is to help to increase that service and also to create ways that if the mother or if the child cannot see the nurse because it's not their date to be in the village, there's a way for them to get out. It is important to see them in their communities, but it's also important to have a way that they can identify when something is going wrong, when something is not right, and know exactly where they need to go. So do I need to go to the health center to see the nurse, or this is something that I need to take directly to the hospital? And it's also important that when they get to the health center, when they get to our hospitals, there's somebody there to receive them and they're able to get the care that is needed and of quality. So that's how the initiative has been helping out.
Now, as I said before, this is an important indicator for the development of the country. And in fact, we have been doing fairly well. It was one of the Millennium Development Goals, and I know there's been quite a bit of initiatives before trying to ensure that we had as low as possible maternal or infant mortality. Tell us how this project helped to close the gap that we were facing. Where were we before, and what has this allowed for us to be able to do?
So how the initiative has been helping is that previously we would focus on hospitals. So we're worrying about what happens to the patient when the patient gets to the hospital. And we weren't looking at the patients on a whole, because sometimes a lot of the factors that affect maternal mortality and neonatal mortality and infant mortality, it's it comes from different areas. So it's not always just because they got to the hospital and something wasn't there. A lot of the times it's the mother being at home and she's a diabetic or she's a hypertensive and she's not controlling her illness the proper way from the beginning. And that causes a complication in the pregnancy. And so with the initiative, that's what we've been doing. We've been working with primary care and secondary care. So it gives you the ability to look at the patient overall rather than just when they come into the health system.
And how successful have we been in that? Because one of the things that we've heard repeatedly from the Ministry of Health is trying to get pregnant women to have early check-ins, which means as soon as you miss your period or as soon as you figure out you might be pregnant, that you go to a clinic. But there is usually people wait 3, 4, 5 months before they go in.
So for us in the project, getting our women to do early check-ins is still a work in progress. It's something that we've been working on, and our biggest challenge is to get people to understand that, you know, our culture and our traditions is very important to us all over Belize, but now with the knowledge that we have now, we also need to understand that sometimes we need to tell our grandmothers and our mothers, you know, I understand that what tradition is, but there is something that's more important, and to understand that coming to the clinic early is a great way to ensure that you're starting off your pregnancy in the right way. And if something is wrong, it's the opportunity to start to work on it from now rather than wait until you end up complicated at the end.
You know, that's definitely a task. That much I could tell you because we're so used to what it was back then. You know, and I also wanted to touch on where the project is being rolled out. Is it for the entire country, and where do we see the largest concentration of this?
So the project is not in the entire country. The assigned project area is for the Curacao, Orange Walk, and Cayo district. But what the Ministry of Health has also been doing is that the best practices, so the lessons learned and the things that we've seen worked in the project area, we've been implementing it in the other regions of the country. So technically the entire country is benefiting from the project. It's just that the evaluation of the project that takes place every 2 years happens only in those 3 districts.
Ignez, set the background as to how Belize compares to the rest of the region and the other countries that have been implementing this project.
Well, Belize has had tremendous progress in several maternal and health indicators. I mean, just to give you a sense, right? Thinking about health checkups for children that are younger than 23 months, it went up from less than 5% to almost 70% in this period of time. And we think about like indicators for maternal health, like for instance, use of contraceptive methods right after you have a baby, which is very recommended, so you can, you know, focus on that child. It went up from less than 10% to almost 90%. So this is like a tremendous progress, and Belize compared to other countries is very ahead of the curve.
We like hearing that. But you're giving us great insight into some of the indicators, and I want to explore that further because some of them are very traditional. When you talk about contraceptive or family planning practices, oftentimes it can get a bit touchy, you know, the religious perspective, and even just looking at some of the misconceptions people have. If you're breastfeeding, you won't get pregnant. How do you overcome some of the cultural and traditional barriers? Like, I don't need to have the baby in a clinic. I get a midwife or a birthing assistant or someone in my community who helps women have babies.
So for the Ministry of Health, what we've been working on is health education. So from your first visit to the clinic, when you find out you're pregnant, you start being educated. Every time you go, the nurse sits down with you and she explains to you why is it important to have your baby within a health facility where you have the doctors and the nurses, where if anything goes wrong, there's somebody else there. They have the equipment that they would need to attend to you. And what it does is that it's like you go creating that awareness throughout the time that you're there in antenatal care. It's the same thing with contraceptives. So we know that normally they would say, okay, so if you're exclusively breastfeeding, it's okay, but we also know that everybody responds differently.
Yeah.
You know,
And not everybody understands exclusive breastfeeding.
Yes, and so sometimes that's also misunderstood. People feel like, okay, so I'm breastfeeding and I'm bottle feeding, and because they said, okay, breastfeeding, it's fine. And what they don't understand is exclusive breastfeeding means that that's the only thing that you're giving to your baby. And
not even water, grape water, nothing.
the breast milk has everything that your child can need for the first 6 months. And so because of that, and because we're aware that a lot of our women in Belizean society, they work, you know, and we get to be home for a while, but after 6 weeks, a month or so forth, we have to return. And that's normally where the exclusive breastfeeding becomes a bit more challenging. And so that's why we recommend that after giving birth, you go on a method. And it also helps you because it gives your body the necessary time that you need to heal, to recover from delivery, and it allows you to be able to decide when you want the other child.
But
and ideally, you should give your body 2 years,
2 years.
Yes.
in between.
Yes.
But going back to the health indicators, though, let's talk about where we saw, because those are some interesting numbers that you gave us. The most progress so far.
So the most progress we've seen so far are in our indicators that are related to the process of care. So for our hospital indicators, we had the indicators that dealt with the immediate care of the newborn. So as soon as the baby is born, what is being done, and documentation, so writing it down so that somebody else can come back and see. We also saw a great change in the indicators that had to do with the routine care. So after my baby goes home, how often do I bring back the baby to the clinic? Do I wait only until a vaccination is due? And for the first year, that works fine because it coincides. You have them there almost every 2 months. But when the baby hits 12 months, the vaccines are more spaced out. And so that's where we start to emphasize that your baby needs to be checked up every 6 months. And it allows you to monitor to see that they're gaining weight properly, that they're increasing in height properly. And these are things that can say, okay, well, my child is growing up healthy.
Does this give, it brings me to the conversation now that while we've got this project going on and mother and child are being benefited from this, what about for our healthcare providers? What about for our nurses, our doctors who have to deal with these folks? And I'm listening to the information, and of course the information is out there. But these people who provides that care for mother and child needs to eventually have this information. Does this project focuses on them as well?
So all of our doctors and nurses within the project area, everybody is trained. So at the beginning of each operation, we do training on the indicators, and what we do during that process is to explain. So this is one of our indicator, what it entails and what are the things that we're looking for. And the project in itself has a monitoring and an evaluation process attached to it. And what that does is it gives the follow-up. So it's having somebody there with the nurses and the doctors that's accompanying them. And we go out on a monthly basis, and we're in the health centers with the nurse. We're watching them work. So they get to have somebody there, and it feels, for them, it's good because, okay, I have somebody that knows what I'm going through, and if there's an issue, you have somebody that can help you resolve or find the person that can help you to resolve the issues. So our doctors and nurses are trained in each of the indicator, and all the services that they're given are services that falls within the protocols and the guidelines of the Ministry of Health. So it's not like we're asking them to do things that is not a routine part of what they do on a daily basis.
So you spoke of getting people to bring their babies beyond 1 year for a check-in. Now, I can see that in an urban area, being once you've been educated, that you'll go the additional step. But if I'm living in a rural area, how does it work? Because there is an additional cost added in if I have to come from Sartaneja into Corozal town to go to the clinic.
So this is where the rural health centers come in. The rural health nurses, those are the nurses that give child health care. So for example, Sartaneja has a health center.
Yeah.
So the mothers bring their babies.
I used the wrong Guinness. I was going to say Shanush, you know.
So the mothers bring their babies to the health center to see the nurse, and the Ministry of Health also has a system that if I'm the nurse and I see, okay, for today these are the babies that I was supposed to see, and for whatever reason Marlene doesn't bring her baby, at the end of the day the nurses go out to do what we call home visits.
Okay.
So they go to the home and they check to see if the baby's there and find out why the mother didn't take the baby. And most of the time they can weigh the baby at home, which for us, ideally we prefer that you bring them to the health center because the record is there and it allows the nurse to be able to monitor how your baby has been doing throughout the time. Chinush, nurse goes to Chinush, for example, but they do mobile clinics.
Yeah.
So in that mobile clinics, they give child health services.
Okay.
So you can count on it that the nurse will be there either once a month or once every 6 weeks, and that's when they see.
So that was the indicator that we saw the most progress. Where did we see significant challenges?
Antenatal care.
What is antenatal care?
So antenatal care is early booking. So as soon as you miss a period, as soon as you take a pregnancy test and you find out that you're pregnant, you're supposed to go to seek medical attention. And that's our biggest challenge, because tradition tells us that you wait your first 3 months just in case. And
it's almost like taboo.
Yes, and so that has been our biggest challenge, and it's a work in progress. We know it has a lot to do with education, and one of the things that the project is doing is called communication and behavior change. And we had an anthropologist come in, and he was out in the country and he interacted with the population to get their feedback. How do you feel about us telling you that you should go to the health center, and what are some of the challenges and what are some of the reasons that our women aren't going?
And what did you find?
So he found out that a lot of the time the women prefer to wait. My mom says that I should wait, or you shouldn't let everybody know you're pregnant too early because you don't want, and
Tradition.
yes. So he found out that our biggest issue was tradition. And we can't go against tradition because that's who we are. It takes away from us. So.
And another action that we think the initiative that the ministry is considering has piloting for communities is a community participation platform, right? Which is bringing people from the communities, social actors, social organizations, to really help the community see the benefits of doing things like that, which is going to be like very key for early captation of pregnancies.
One of the
So
things,
like I don't want to say an ambassador, but one person who has the information who can maybe talk to the other
So
ones.
it's bringing in your social peers,
Yeah.
and we train, we educate them, and then they become the voice in the community, because we have seen and evidence has shown that it's easier for me to listen to one of my peers and somebody that I'm around every day, rather than somebody coming from outside to tell
stranger.
you should do this. Exactly. So that's why the community platform.
Ignez, is this unique to Belize, the early booking challenge?
No, actually, this is a common challenge in most countries. And exactly because of that, right? Like people, they used to think that they don't need to come in early, that they can wait. And it's hard for them to see the benefits of coming early because they still don't feel many symptoms.
Yeah.
And so it has been a challenge everywhere.
So what is the difference between checking in within that first month if I miss my period, or waiting 3 months till it's safe to tell everybody that I'm pregnant? What's the difference in terms of my health and the health of my child, most importantly?
The first 3 months of your pregnancy is the formation. So this is that point where a huge part of your baby's physical development occurs. So taking your prenatal, getting iron, getting folic acid, these are important elements to developing a healthy baby. So that's one of the reasons when you're talking about the baby. But for the mother, it allows your doctor or your nurse to be able to see what you're like, your baseline.
Yeah.
So because it's so early, a lot of the changes hasn't really started to happen to you, even though your child is developing. And it, like, for example, your blood pressure at 4 or 5 weeks is still what your normal blood pressure would be if you're not pregnant. So in the future, if your doctor or nurse sees that, you know, they're getting a higher reading, they can look back and say, okay, her normal is this, and she's up there, so we need to keep a closer eye. We need to start looking out and to ensure that she doesn't end up with a complication related to hypertension. So it gives them what your normal is, and so they have something to compare as you go progressing along in the pregnancy.
What are some of the common signs, and I'm saying this for the fact that some people find it, you know, heavily reluctant at the time to want to go in. They want to wait that 3 months. What are some of the common signs thereafter that an individual can find out, you know what?
Signs of pregnancy.
Of pregnancy.
So the most common sign is that you don't see your menstrual period. So normally we say 6 weeks after your last period and you haven't seen a menstrual period, we recommend that you contact a healthcare provider or you take a pregnancy test. If it's positive, you go in. We do know that there are exceptions. Some women start with nausea, some women start with, you get tender breasts, and so yeah, they're tired, or some women don't have any symptoms at all, and you have other women who can tell you, well, you know I'm pregnant.
Yeah.
So it varies from person to person. The most common thing to look out for is a late menstrual period or an absent menstrual period, and you take the test.
I'd imagine that part of the challenge is if I'm not a first-time mother, I don't know how this goes. You know, this is no. If I'm on number 3, this is no brainer, right? Is this where we see some of the most reluctance?
Yes. So for our mothers that have had kids before, that is an issue, especially the mothers who didn't have a complication, you know, during the previous pregnancy. So those are the mothers who say, well, I've had 5 kids and I've never had an issue, so I don't need to go. And one of the things we keep saying is, remember, each child is an individual in itself.
Yes.
So there's no guarantee that because your previous pregnancies were uneventful, that this one will be also.
Yeah.
And so that is a challenge, but education is key.
Yeah.
So we keep educating at every point, every health facility you go, every health professional you come in contact with, they keep doing health education, and we keep saying the same things. So that's also important, that everybody understands what you're doing and everybody is giving the same message.
Wow.
So let's talk numbers. What type of progress did we make? It was a 2-year program, right?
Actually, it started in 2012.
Okay.
But it's a project that is divided in 3 parts.
Okay.
Yeah. So each part has 2 years. So in the first part, we work together, focusing very much in guaranteeing that all hospitals and health clinics had all the inputs and equipment they needed to deliver the services. And the last 2 years, the focus was very much increasing health coverage and also improving the quality of the services that were provided. And now we are just about to start the last phase, which we're going to continue working on improving coverage and quality, but we are adding 2 new areas of work.
Okay.
One is preconception care. It's even before the women get pregnant, like keeping them healthy, especially if they have, let's say, chronic conditions, right? And the second thing, which we're very excited to work on with Belize, is early cervical cancer screening. So this is another different area of work, and it's very important.
Yeah, and that's a very critical area.
Yes.
Now, let's start with preconception first, because this is really going to baffle people. It means that we move to a phase where pregnancies are planned. I don't know what the statistics are, but my guess would be that very few are.
Yeah.
Preconception, why is this important, and what are you talking about in terms of getting your body ready for what people believe is just a natural process?
So preconception care is about preparing yourself. So I want to get pregnant. And at the same time, I want to ensure that my pregnancy is going to be as healthy as it can possibly be and as uneventful as possible.
Yeah.
So it's me going to my doctor and say, well, I'm ready to have a child, because being mentally prepared also plays a very important role in having a healthy pregnancy. I want to get pregnant, and when you say that, the doctor will sit down and he has a conversation with you as, you know, to age. How old are you? Are you at the right age? If you have any other illness from before, any chronic illness, your family history, which is also important, and
Whether you're overweight.
if
Yeah.
you're overweight or not. And they also look at your type of occupation, your socioeconomic status. So it's for them to know how to prepare you for your pregnancy, because each pregnancy is different.
Yeah.
And that's that kind of conversation. They do your blood tests to see if your blood levels are okay.
Yeah.
They make sure that you have no infection and that your body is in optimal condition to get
Yeah.
pregnant.
Okay.
You know, it's very important as well, because let's face the fact here. We've been talking about mother and child, but the father does play a very important role, and we need to incorporate that into today's day and age. So what's going on for that?
So normally what we do for the Ministry of Health is that when health education is done, if the partner is present, he plays an active role. So during antenatal care, the conversation is never only about the mom. And when they talk to the expected mother, they'll always say, you know, your husband or your partner is there as your support. And that's what we keep saying to our male population. You're there to support the expected mother, and you play your part. So now the Ministry of Health has the birthing companion, you know, process where if your wife goes in to have a baby and it's not a complicated delivery, you can be there with her to give that moral support. And this is how we incorporate, because sometimes men think, like, if you're not there to see it, you get the impression that it's an easy process.
Yeah.
And also, in cultural context, sometimes men are the ones who hinder women from going into checkups as well.
Yes.
We've seen in some communities, not all.
Not all.
So that is going to be phased in now. This is going to be what, health education awareness? Is that the approach that we're taking?
So the community platform works in a way that it discusses the issues that are of that community.
Yeah.
And it teaches you. So it's for you to be able to see it from, okay, so it is not an obligation, but it is something that we should do, because in the future, it is something that will benefit everybody.
Yeah.
And so most of the communities that you go into, they're aware of everything that's happening. It's just that they don't really have somebody there with them to really let them see it from a more personal level.
Okay. Okay.
And
trigger the action.
Yes.
Yeah. So that is one area that for the next 2 years we'll be seeing. And let's talk about the cervical cancer, the early screening and detection, because this is still something. And I know, the Cancer Society is working, BFLA is working, quite a number of organizations are attempting to address this situation where too many women in this country die from what is a preventable and treatable cancer. What are we hoping that Salud Mesoamerica will be able to do in terms of closing that gap?
Well, definitely increasing the number of screening,
Yeah.
the proportion of women that are taking that test every 2 years.
Okay.
So that's definitely very important, because cancer mortality, cervical cancer mortality is the second leading cause
Wow.
of cancer deaths for women in Belize.
Yeah.
So it's something very important, and it's something very preventable, right? And we are looking into different strategies, right? To be able to bring that screening much closer to the population. They won't be needing now to go into hospitals, right? They can do that in health centers,
Okay.
even rural health centers.
Wow.
Now, Ignez, from the IDB perspective, you finance the project, but there's a unique aspect to this, and You know, I don't know if it's the first time you've done it or if it's been done in other projects where the government had to front the money first, and then I'm supposing after indicators are met, you reimbursed. Explain this to me.
Okay, so this is called a result-based finance model where we co-finance the activities. So in this case, the government puts 50%, we put 50%, and there is these indicators. If the country meets the goals in those indicators, those targets, then IDB gives back to the government 50% of what they invest.
Wow.
Is this a new approach to offering development finance?
Yes, definitely. And what we have seen working with countries in all Mesoamerica, from Mexico to Panama, is that it's a model that works.
Okay.
Because it really has the buy-in, it creates incentives for people accelerate the progress in meeting those targets. And also, I mean, the model, it has this innovative financing mechanism, but also provides technical assistance, really accompanying countries in all the process.
Okay.
Oh, great initiative.
That's added
actually.
pressure for Ministry of Health,
Yeah.
huh?
The initiative is there.
So not quite.
Okay.
The indicators that we have for the project are all indicators that are a part of Ministry of Health's objective. So it's basically they're coming in to help us to move along these indicators. Having the financial assistance helps us to go a bit faster than under normal circumstance. But the incentive is for our nurses and our doctors at the health center, because the project also has an innovation fund. So part of the project, what it does is that the nurses that meet their indicators, meet their targets in a more creative fashion, and they keep coming up with new ways of how to get to their target quicker. They get back something for their health center.
Oh, nice.
And for the workers of the health center. So in the first
So it's
operation,
performance based down to the grassroots
yes,
level.
Wow.
yeah,
Okay.
it's not only at
Yeah.
ministry level.
Yeah.
Okay.
That's awesome.
Extremely. And then
I
when it
did ask the numbers though in terms of how we're doing with maternal and infant mortality. What are we looking at in the past year?
So in the past year, what we've been discussing is that maternal and neonatal mortality is something that has multiple factors that
Yes.
that affect. And it's one of the impact indicators. So it's one of those indicators that you start working on it now, and you don't really see the impact until after a couple years.
Yeah.
So it's not one of those indicators that like child health that you can see an immediate result.
Yeah.
So what the project and the ministry is doing is that we're improving our services so that down the road, when we get to that point of impact, we can see the change that we're looking for in our numbers.
Yeah. But you would see direct impact with maternal mortality at least, maybe not with some of the indicators for the children.
So
If a woman progresses through her pregnancy healthily, gives birth.
Well, yes, in a way, what we have seen, and that's why the third project focused on preconception care,
Okay.
is that it has reduced the number of causes, direct causes.
Okay.
Let's say things that are related in the process of care or that the woman is arriving early on to get that care. A lot of other factors now are actually playing a larger role, like for instance, having some kind of pre-health condition, like some chronic disease and things related to that, right? And that's why we have decided to come early on, even before the women get pregnant.
Yeah. Yeah. To get them ready before that.
Yes, exactly.
All right. And I have one final question, because it is a conversation that's taking place globally, and we're talking about essentially the birthing process. One of the things that health organizations are speaking about is the number of C-sections that are taking place in countries. And again, I don't have the numbers. I don't know, maybe you do, in terms of how many mothers are giving birth naturally versus C-sections. But it is, from what the scientists are saying, or research is saying, it's just more than really is necessary. Does this fit into this project at all? And is that something we're looking at?
So as a payment indicator, we're not looking at C-section rate.
Okay.
Off the top of my head,
Yeah.
I can't
Yeah.
really give you a number, but it is something that we have noticed that over the past couple of years we have had an increase in the number of C-sections. We also need to bear in mind that the specialist makes the decision whether or not he or she believes that that patient will need a surgical intervention. And this varies based on the patient's condition and also based on their previous history.
Yeah.
And so sometimes it's a life or death situation. Sometimes it's because the patient has had a previous C-section.
Yeah.
But it's something that's dealt with on an individual basis.
All right. Thank you for answering that question. But we want to thank you for coming in
Thank
and
you.
really letting us know what's taking place. And we really wish you the best of luck. Obviously, a healthy mom, a healthy baby is just contributing towards a healthier society later on. And that's an important investment to make. So thank you for coming in.
Thank you for having us.
All right, we're going to go ahead and take a break. When we come back, we will be talking about the launch of a new organization. It's called the Belize Brain Awareness Society. We'll find out more after the break.